and let's go forward in this time of sharing one with another. So let's start with a little bit of background information about why we're here today. We had a wonderful session this morning led by Nigel Henley that kind of broke down the national landscape, the DC landscape, and some of the statistics that relate to menstrual health equity in education across our country. Today, in this session, we'll deal more with what is happening in the DC landscape and want to begin by just setting the stage for us here. So effective March 15th, 2022, the expanded student access to period products was enacted. And a part of this law, and this DC law, where there were three main primary requirements. The first is that LEAs must install and maintain dispensers for pre-period products in both women's and gender-neutral restrooms. The caveat to that is that if a school did not have, or LEA did not have gender-neutral restrooms, it had to also be placed in boys' restrooms to accommodate for all students, be they cisgendered or gender nonconforming, transgender, or any part of gender identity. And so we want to encourage schools to know that it is a requirement that all students are reflective in the access to period products. Secondly, that OSSE must develop, in collaboration with DC Health, a sign to accompany dispensers, and that sign will be placed next to the dispensers with instructions for safe use and disposal of period products. And then lastly, that in collaboration with key stakeholders in the DC education landscape, OSSE would develop menstrual health education standards for learners of all genders, regardless of gender, beginning in grade 4. So again, including all communities within that. So students who are menstruators and non-menstruators are learning about menstrual health beginning in grade 4 in the District of Columbia, both in public charter schools and in the public school system. So that's a high-level overview of the law that grounds our work today. I want to go a little bit further and also add that these standards, while these standards are being presented today, we expect that these standards we know they will be included in the national health education standards, which are currently under review, and we anticipate that those standards will be revised in this coming year. At that time, OSSE will undergo a broad review of all of our DC health education standards with a special focus on equity and inclusion once the national process is complete. And so we also look forward to you engaging with us in that process. Once we have received the word of the national standards being updated, OSSE will begin the process of updating our specific standards. So these standards today are an addition to the existing health education standards that already are already in effect for the District of Columbia. Thank you, and you'll notice that Nigel has been putting some links into the chat so that you can have easy access to both the webpage and the law that dictates and will overarching themes for this particular discussion today. So I want to also be very transparent as we've been throughout this entire process and share briefly about the draft process for the standards themselves before we talk directly about the standards. So the Office of the State Superintendent, or OSSE, is was according to the law, tasked with drafting standards that would be used for menstrual health education. These standards provide a clear, skills-based, and age-appropriate approach to this essential health topic and renew the district's commitment to comprehensive health education. A comprehensive health education curriculum is essential to increasing student agency and literacy and creating inclusive, safe school spaces. These standards aim to empower our students to become more active participants in their own health while maintaining dignity and respect for fellow students as they grow and develop. And so as required by the law, OSSE developed menstrual health standards for all students regardless of gender. And those standards were, then we put those standards in comparison to a national literature review to see if there were existing standards for menstrual health education within other jurisdictions. The findings were very limited, and it has now been determined that OSSE would be drafting these standards from a blank canvas. Over the past several months, OSSE actively engaged with district agencies and other local and national stakeholders, including DC public charter schools, DC public schools, health educators, community-based organizations, university partners, and pediatric healthcare providers. DC also engaged in an open comment period to invite all members of the DC community to share their feedback and thoughts about this process. So similar to the DC Health Education Standards, the supplemental menstrual health education standards are arranged by grade bands, and they are aligned with corresponding National Health Education Standard strands. So this chart here kind of shows you the process from cradle to release of the standards and what we did at different points in the last year to get to arrive at today. What a great day to celebrate. So the menstrual health standards, let's go right into those. They are divided by, as we said, grade band, so that by grade 5, grade 8, and grade 12, there are specific foci for each grade band. So through grades 3 through 5, it focuses on building a functional understanding of the menstruation cycle, physical and emotional changes, communicating with trusted adults and peers, and product accessibility. That is the goal of the overarching grade band 3 through 5. For grade band 6 through 8, we find an in-depth focus on menstrual cycle, personal decision-making, and analyzing influences, avoiding period stigma. And then for grade band 9 through 12, we find a focus on menstrual health, irregularities, independent management of personal period health, and the community health implications of period stigma and inequities with period product access. So those are the overall themes of each of the grade band standards. So we have an understanding of what is to be accumulated, what is to be learned at each level for all of our student learners in the district. At this point, the next few slides will have quite a bit of information on them. They will be the actual standards themselves, and we will read them, and we will create hopefully an understanding of what they mean and what they mean in practice, as well as an understanding for students and for educators alike. And so the first set we will look at are those standards for by grade 5, grade band 3 through 5. By grade 5, students should be able to, and you will notice that there are 8 strands across the top. The 8 strands are health promotion and analyzing influences, accessing information, communication, decision-making, goal setting, health behaviors, and advocacy. So those strands will be present in every grade band that you see. You'll see those strands existing. You might not see a standard under each grade strand, but you will see that they're overall covered throughout the entire process from grades 3 through 5, 6 through 8, and 9 through 12. So by the time a child reaches 12th grade, they would have learned all of these things at the appropriate age and grade level. So that you also have another tool for troubleshooting here. If these are too small for you to see on your screen, if you're working on the Teams app, you can enlarge your screen by just using your trackpad to stretch out, and then you can see a larger image of this, and then stretch back to scroll through. But for health promotion, we want to, by grade 5, students should be able to explain the function of the menstrual cycle, give examples of the physical and emotional changes that occur in response to menarche during menstruation, and then during accessing information, students will identify how to access free and available period products within the school building and in the community. For grades 5 in communication, by grade 5 in communication, we expect our learners to describe how to communicate with and ask questions to a parent, guardian, healthcare provider, peer, or trusted adult at school regarding the experiencing menarche. For decision-making, our learners will describe how students can manage period and period-related challenges and or show support to their menstruating peers while in class and or participating in extracurricular activities. They will also, under healthy behaviors, learn how to describe healthy behaviors during menstruation, including ways to maintain personal hygiene and cope with emotional challenges and manage pain. And then lastly, in this grade band, under advocacy, our students will identify what they need to do if a peer is experiencing period discrimination and or shaming by reaching out to a trusted adult. I should also add that all of the standards were intentionally degendered to include students of every identity, whether students are cisgendered or a member of the LGBTQ community or gender nonconforming. These standards encompass all of our learners and allow all of our learners to experience, whether they are a menstruator or a non-menstruator, to have a greater depth and understanding of how to engage and how to ensure that their peers receive respect and dignity during the menstruation process. So that's a theme that we want to be sure that we always lift up, because it was very intentional in our work that we've ensured that these standards do not exclude any community that lives and thrives in our schools. We want to ensure that all of our students, all of our learners are fully supported as best as possible. So those are the standards by grade strand 3 through 5. Next, we'll look at by the standards by grades 6 through 8. And you'll see that under health promotion by 8th grade, oops, I'm so sorry, my cursor's moving fast there. By grade 8, under health promotion, students should explain the 4 phases of the menstrual cycle and how menstruation intersects with other aspects of reproductive health. Also identify factors that contribute to changed or irregularities in the menstrual cycle, including but not limited to age, diet, physical activity, stress, menopause, birth control, and alcohol and tobacco use. Under analyzing influences, our students should be able to discuss how personal values and stigma about menstrual health management appear in society and consider their impact on the health and behavior of individuals, and recognize differences between reliable and unreliable sources of information on menstruation. Under accessing information, they should compare and contrast the impact of various types of menstrual products available, including both disposable and reusable period products, depending on preferences and activities. Under communication, our learners should demonstrate effective communication skills that menstruators can implement to communicate changes in menstrual cycle with a parent, healthcare professional, or another trusted adult. Under decision making, our students should be able to provide examples of safe, reliable options, not limited to medication, to address menstrual pain, discomfort, or excessive bleeding. Under healthy behaviors, our learners should be able to explain how tracking the menstrual cycle may benefit individuals and identify safe, reliable methods for tracking the menstrual cycle. And then lastly, under advocacy, our learners should be able to generate strategies to interrupt, prevent, or challenge menstruation-related teasing, bullying, stigmatization, harassment, and discrimination, including how to safely report such conduct to a trusted adult. And you'll notice that we've also mentioned trusted adult quite a bit in our standards, because we want students to know that the trusted adult could be anyone in that school environment or their home who they are safe and comfortable to speak with and to share these very, very, very personal details about their development with. And so we encourage students to always identify safe and trusted adults. I'll do another shameless plug here for the session that will come after this around the period products poster, which will be led by my colleague, Lizette Garcia Acosta. She will talk more about the importance of trusted adults and the work that we do. And we also want to be sure that we are encouraging all of our students to engage in safe and reliable conversation one with another as peers as well. And then lastly, the last grade band is for grades 9 through 12. And I've broken these up into 2 slides so that it's a little easier to see, because these slides are a little bit more detailed in the information we have provided. So you'll see the strands 1 through 4 on this slide, and the slide after this, we'll see strands 5 through 8. So by 12th grade, students should be able to A, know everything in grade band 3 through 5 and grade band 6 through 8, but also by 12th grade, students should be able to examine and describe signs, causes, and symptoms of menstruation-related health conditions, including endometriosis, fibroids, premenstrual syndrome, and polycystic ovarian syndrome, and explain strategies to manage and reduce discomfort. Discuss the effects of contraception use and on the menstrual cycle and the reasons for using contraception. Under analyzing influences, our students should identify how period stigma disproportionately impacts menstruators depending on protected traits outlined by the DC Office of Human Rights, and the consequences this has on menstruators' health and behavior. I want to pause and just also share that this is another place we were intentional to include the protected classes of DC, which is outlined by the DC Office of Human Rights. So that means that we're looking at all those classes that are protected within that within the confines of the agency to ensure that all communities are safely represented in these standards and that there's never an experience of stigma or discrimination by a student or by an administrator. Thirdly, in this section, under accessing information, students should be able to compare and contrast menstrual products and menstrual suppression. They should be able to evaluate the costs, benefits, safety, comfort, and environmental impacts on menstrual products and menstrual suppression options, including both disposable and reusable menstrual products. In communication, our students should plan how to communicate effectively and listen actively to others around privacy and intimacy while they appear or partners are menstruating. So those are the first 4 strands of this particular grade band. Let's look at the last 4 strands of this particular grade band for 5 through 8 strands. Under decision making, students should identify when the menstrual health concerns should be discussed with a trained or trusted healthcare professional. They should set goals here, designing a health goal for menstruators to maintain menstrual health independently, analyze how family, peers, and healthcare providers might support or hinder its achievement, and recommend action steps that will encourage progress towards its achievement. And then lastly, under advocacy, by 12th grade, students should be able to critique the ways their communities are and are not supporting menstrual health for current, former, or future menstruators and devise possible solutions or improvements. So I know I've just read a lot to you, right? All of the standards there I've just read to you so that you're able to see them in what they look like in final form. I want to reiterate that these standards were approved by the State Board of Education, and there were several conversations with other stakeholders from other agencies and other disciplines to ensure that we were being equitable and inclusive. And we want to have a moment now, after hearing those standards read aloud, to open up a discussion. And that discussion is simply one question. What resources do you think your school will need to implement these standards? And so we want to open up this time to ask questions. You can, as I said, type them in the chat, or you can raise your hand and we can unmute you, or you can unmute yourself and you can ask questions that we can answer. If we're not able to answer the question immediately in this chat, we will acknowledge that question and we will be sure to get a response back to you, understanding that they might require further research or our engaging beyond this particular session to respond appropriately to any question. So I'll open it up now for any questions that might exist. And I see that Ms. Miller, you have your hand raised. If you will unmute yourself, you can share your question or your thoughts now, and we will have a conversation.
Sure. No, I really appreciate that. Thank you. And I noticed in the chat that that Diana Bruce also addressed a similar concern that I have, which is, and I just want to start off by saying I absolutely appreciate the degendering effort that you put into that. I heard through the SBOE presentation the work that you did put into that. I know that I submitted comments regarding a slightly related topic, which is beyond degenerate, which is taking into account how the dysphoria and the triggering effect of menarche for our transgender youth. It's more than just stigma. This also worsens their dysphoria, it increases their depression, suicidal ideations, et cetera, et cetera. I know the standards have already been written, and that was even the reference to gender identity was removed. So my next question is, how can you work with our schools to ensure that we have some supplemental materials provided that ensure the implementation of these, or the implementation is inclusive and addresses these very specific needs of our transgender youth? Because it's not just about stigma, and I think it's not just about referencing that they are, the protected classes. I think we really have to be intentional and name that this is a very real issue that a lot of our young people are facing as soon as they have their first period, every month that they have to struggle with it. And having a transgender son, this has very real consequences, and he's very lucky to have a supportive home, but not all of our kids have that. And I'll just stop there.
Sure, sure. So thank you for your question. Certainly do appreciate you sharing with us. And I want to also share that the resources that we are providing for schools there will be, we will reference them at the last couple of slides of this, but I'll mention some of them. Of course, we have the webpage. We will offer office hours, technical assistance for schools. But then recently, last year, you might have also heard about the LGBTQ pride investments that the district is making specifically to ensure that schools are safe and inclusive. And that work will be another way in which we can support schools in ensuring that students, specifically to your question, who might identify as transgender or gender nonconforming, who might be experiencing all the other emotions that are related to the biological things that are happening in their body, which might create, to your point, gender dysphoria or all those types of things. Those pride investments will go to reach those types of context, right? So they will also be inclusive there. They're specifically to make our schools inclusive to LGBTQ students, staff, school members, and to make sure they're safe and inclusive places. So all of this will be included in that as further supports for schools going forward, as well as our monthly office hours, which are to come. We'll also have a technical assistance and training program where schools can get one-on-one training and resources development for their particular context. Some schools have already begun to engage in that process around this, even in advance of this rollout today. And then lastly, there's always a feedback loop that we have on the webpage where if a parent, a student, a teacher, an administrator is needing to get more specific resources, they can send feedback directly to our team at Health and Wellness. It'll come directly to us, and you'll get a one-on-one response from us to be able to address anything that may not be covered in between these standards, the pride investments, and other resources that we put out over the next several months, for sure. Hopefully that begins to answer your question.
I can wait until the end or take more of this offline, but I'd like to know a little bit more about that and how we can guarantee that those conversations are going to be linked and that we'll see them across all schools, not just schools that maybe have more resources, have a different, I think that sometimes this is a challenge across schools, is that we don't see these applied at a standard that would affect all students. And I know, and I say this because I've talked to our LGBTQ health and at DCPS, and this is a challenge for them as well.
Right. I will also add, Miss Miller, excuse me, I should use your last name, that at OSSE, curriculum is determined by the local education agency. And so it is the central guide for all educators. So at OSSE, we don't dictate curriculum. We don't decide what a school should do in response to it. It is our responsibility to ensure the law is communicated and that school systems, LEAs, local education agencies, are responsive to those requirements of the law. And that's why we're making a point to have a specific day for these specific brand new standards. I will say that we are in a constant learning stage. We are the first jurisdiction in the nation to have this happen, which is huge to celebrate, which means we are also the learning place for everyone else. And so that means we're always open to receive feedback, to receive questions, to receive resources that you might be aware of, that might be general things that we can work through the chains to see if that works to support our schools. But we are certainly learners more than we are dictators, right? We want to be sure that folks know that we're open doors for communication, education, and supporting our students, specifically our LGBTQ students, our transgender students, our gender nonconforming students, but every student, be they a menstruator or non-menstruator in our school systems. Any other questions in the chat today? Any other questions that you want to come off of mute or type into the chat? See some folks typing, so I'll just pause and allow that to happen. I'll also share that as we are waiting for folks to type in the chat here, well, that we have, I think, a wonderful way for schools to be able to engage in this work. See some chats there, but a wonderful way for us to continue to engage in this work will be through, they're putting it in the chat box for us now, the links to that direct feedback for our team. That is our team inbox. Rachel Sadlon just put into that chat. That comes directly to the Healthy Schools and Wellness Programs team. All of the folks you saw in the beginning of this presentation are on that team, and we will be responsive immediately, as immediate as possible to respond accordingly to any requests that come in that way. And I think our Assistant Superintendent of Health and Wellness, Tia Brumstead, is on the line today as well. Thank you for your comments and support in this process. Were there other questions that I missed? I will leave the chat open for us to add questions. We'll check back again before we end the conversation today. But I do want to share some of the resources that exist currently for us now. As I've mentioned, the webpage, which is a screenshot you see there, all of these images you can click on right now and go directly to them. We also have a resource from Period, the Menstrual Movement, a partner of ours that has helped with some of the work that was done in development of the standards, and a toolkit that was put out by the state of Oregon that really has some great best practices for schools, for students, for learners, and for families to gain a better understanding of this. All of these resources were available to us because they're open source and they're available for everyone to have and to share broadly, okay? Also want to share that there are 2 other sessions today that are going to be happening. The Period Products Deep Dive, which is right after this at 2:15. As I said earlier, my colleague Lizbeth Garcia Acosta will be leading that. And that's a session you do not want to miss because it'll be a detailed examination of that poster we mentioned in the early part of the session that accompanies the dispensers for free period products inside the restrooms. And then for students, we're excited because we want to hear their voices as much as we hear ours and as much as we hear adults. We have a session just for students today from 3:30 to 4:30. Where they will get all of this information, but then they will also have an opportunity to speak up, offer feedback, share their thoughts on implementation and rollout, because who better to tell us how we're doing than the person's most impacted by this work every day in schools. And so we've made a special session for just our student learners to be a part of, and that's facilitated by students for students. There will be a couple adults in the room just so that we can take notes and be present to support them, but it'll be a space for our students to have safe space and to share candidly and openly about this entire process with us even more as we continue to always put them forefront in our work. So those are our resources that we're sharing today. I'll thank you all for sharing resources in the chat. That's a great place to also drop those in that we can look at them and share them as appropriate widely. Thank you, Diana Bruce, for sharing that resource. We also are excited about this product, this time and this time of celebration and this time of learning today. I want to pause and ask if there are other questions. You'll see in the chat as well that there's a link for the student session. There's a link for the Period Products poster session after this. Even if you haven't registered yet, you can still do so so that we can have you there and welcome you to more conversation there. Resource on specific registration messaging when trans students and monitor the education they need. Thank you for sharing that. I believe that comment relates to the resource you shared, Diana. So we'll make sure that we take a look at that resource. Thank you for sharing that with us. So if there are no other questions or thoughts, I'd like to again ask one last time if there are any questions, thoughts. If not, we will prepare to give you back a couple moments of your time today. And we thank you for joining us for this session. Again, this session has been recorded, will be archived and placed on the website so that we can offer this resource to folks to go back to and listen to as we continue to roll out other resources for this process for menstrual health education for the District of Columbia. Again, E-Taylor Doctor here. Thank you for your time today. Thank you for joining us, and please join us in about 30 minutes for our Period Products session, and then encourage you to join us for the Youth Summit at 3:30. Have a great day.